DentalUnboxing.com subscribers. This is Dr. Tim Kosinski, one of the clinical evaluators with DentalUnboxing.com. Thank you for joining me again today for another dental product unboxing and clinical evaluation. So let's get to it. Today I'm going to unbox something that's pretty remarkable in my opinion. I'm unboxing and going to clinically evaluate in my practice a product from Cometa Bio located in New Jersey called the Smart Dentin Grinder, which utilizes extracted teeth roots to make a dentin autogenous bone graft material. Let's see what's in here. Big box. So what we're going to see is you're going to get a self-contained box with the material in it. So what's in the box is the countertop motor itself that you would just simply plug in. There's an on and off switch in the back. You'll have these disposable grinder apparatus which will connect to the grinder that we'll demonstrate in a few minutes. And then we have a dentin cleansing kit. So we'll go through the process. It's pretty self-explanatory once you do it. So when we have a situation where we're removing teeth, we have sockets. And if we don't graft those sockets, we know as dental professionals that we're going to get some shrinkage. Bone is going to shrink down and in the lower jaw, up and in the upper jaw. The sinus may collapse, which may make placing the dental implants or fitting of conventional bridge work more challenging or less aesthetic. So we want to graft these sites. Well, we talked about different materials that we can use to graft. We can use allograft material, bone from another human. We can use alloplastic material, which are synthetic materials, and those work very, very fine, but they can be expensive in some situations. Well, this is exciting because when I remove teeth, I would remove the root structure, no composites, no amalgams or anything like that, and I can simply use the Smart Dentin Grinder and process those roots in such a way that that can become my graft material. The histologic evaluation demonstrates that we get a very fast turnover because it's autogenous bone. It's from the patient itself. It's the building block of natural bone. We know the process, we know that osteoclasts will invade, eat away that material, and osteoblasts will lay down new bone. So this is a very cost-effective way for grafting and a very safe way because you're using the patient's own byproduct in fabricating your graft material. So I'm excited to clinically evaluate and document this product in my practice for DentalUnboxing.com. And I'll talk to you soon after our demonstration. So here we have a patient that presents with non-restorable mandibular anterior teeth that we deemed to be extracted. We want to do an atraumatic extraction, graft the site in preparation for future dental implants. There are many different ways of grafting. We can use an allograft or a graft from another human, but here we're going to demonstrate the use of an autogenous graft used from actually the patient's own teeth, the patient's own root structure. The coronal portion of the teeth, in my situation, I will remove with a burr because I don't want to use any teeth that have any restorations or fillings, or root canal treated teeth should not be used. So here's the teeth that we extracted, and I'm simply taking a burr and I'm just removing the coronal portion. Now you can use enamel, that's not a problem, it'll just take longer to resorb. Now what we're going to do is we're going to prepare the dentin grinder, and we have a disposable chamber which will be removed from its sterile packaging and placed onto the dentin grinder base. The roots that we prepared will be placed into the grinder and processed for a total of about 23 seconds. You can see that the roots have been cleaned and dried. They're placed into the disposable chamber. We set the grinding for 3 seconds. We will then set for 20 seconds the separation of the grafted material. The particulates will be about 250 to 1200 microns in diameter, which is a good size for grafting. We're then going to put it in the enclosed jar, and we're going to use a Dentin cleanser, which is sodium hydroxide and 20% ethanol, and that is poured into the glass container. That's included with the Dentin grinder, and this particulate is soaked for about 10 minutes. After soaking, a gauze is used to remove as much of the cleanser from the glass container as possible. Then after that, we will use a Dentin wash of phosphated buffered saline, and this will be poured into the glass container, and the wash sits for 3 minutes. After this time, the wash is removed with a gauze also. The graft is now ready to use. We will carry it to the socket sites. Remember, I said that this graft is osteoconductive, serving as a scaffold. It's also osteoinductive in that it stimulates progenitor cells to differentiate into osteoblasts. This graft heals very quickly and very well because it is also osteogenic. We have bone morphogenic proteins, which are the cell mediators in this whole regeneration process, and it rapidly differentiates into bone. Dentin is very similar to bone in its chemical and biological composition, and so this particulate will act as a scaffold and convert as quickly as 7 weeks in the mandible and about 3 months in the maxilla. New bone will be regenerated at this site, and soft tissue response is excellent. Typically, we can get a cc of graft from an incisor, or 3 to 4 cc's of particulate from a molar, or about 3 times the volume of the tooth itself. Healing is shortened, infection is 0, and it's FDA approved. And you can see after 1 week how wonderful that tissue looks, which will allow for preparation of a dental implant quite effectively and efficiently. Hello, dentalunboxing.com subscribers. This is Dr. Tim Kosinski, and I've completed my clinical evaluation on the Smart Dentin Grinder from Kometo Bio. So let's summarize 5 main factors that I considered with this product as we started to use it. Did the product save me time? Well, I'm not sure if it necessarily saved me time, but the cost efficiency was well worth it. Normally, if I do an extraction and I want to graft a site, either to prepare it for a future implant or use it for to prevent future bone loss or minimize bone loss following an extraction, I'm actually using the root structure of the tooth itself. So my patients really liked it because we're using their own body part, so to speak. The materials to use, we're using the tooth, we clean off the tooth, and going through the process, the first time was maybe a little bit complicated, but after I did it 3 times, it became very routine in processing the material to make it a viable graft product. So a time saving, I guess it's easier to take a bottle off the shelf of some allograft material or some osteogen material and placing it into a socket, but there's cost that goes along with that. So it didn't save me time, but in the long run it did save me a significant amount of investment. Was it simple or difficult to integrate in my practice? Well, it's pretty self-explanatory. As I said, the first time it was a little bit challenging. We took teeth out. We want to make sure there's no amalgam or composite. And then just processing the material, it doesn't take a long time. It's just a process that it has a series of steps that you want to follow. And once we did it a couple times again, it became very routine. So, I would say on a scale of 1 to 5, with 1 being difficult and 5 being very simple, I'd probably give it a 4 after I got used to using it. Cost, I think the initial investment seems a little bit prohibitive, but again, not having to purchase allograft material and membrane, which has a significant cost, I think it paid for itself, especially if you're doing a number of grafting procedures and using a lot of material. And again, our patients really appreciated that we're using their own body part. How does it compare to conventional techniques? Well, we can take a bottle off the shelf and pack it into a socket, protect it with a membrane because epithelium grows very fast. The This way, I'm taking a tooth out, I'm actually processing the actual body parts, the tooth structure of the patient, and creating a wonderful autogenous graft material. And so what I saw in my practice was that when we used it, we got faster turnover. Again, because it's the patient's own a body part, we got turnover of the hard tissue much quicker. Again, time is valuable to me, and I think our patients really appreciate it. So I would say, compared to current techniques, I would say maybe somewhat better than current techniques. And would I purchase it in my practice? Yeah, we started using. Once I used it once, I really liked it. The patients were very responsive to it. The staff was very responsive to it. I think it's a great tool to have in your practice for patients that won't allow you to use bone from another human. Or synthetic materials. So again, I think the marketing strategy is that the patient's using an autogenous material of the patient's own body part. So yes, I would recommend it. And again, thanks for watching. And please hit the subscribe button to get any notifications on future videos that we're posting on different products.